Due to COVID-19, the board has previously agreed that we're going to be meeting today via Zoom only. Our opening slide is information about how attendees can turn on the closed captioning subtitles. Let's go ahead and do board member introductions. Dan Gossett.
Good morning, everyone.
Morning, sir. Donna Hanson-Murray.
Good morning.
Good morning. Let me turn up my volume. I thought Dan was coming in a little quiet, but I think I turned the volume down. Amy McGuire.
Here. Good morning.
Morning, Amy. Allison Polson.
Good morning.
Wow, somebody's spunky this morning. All right. Good morning.
Oh yeah, lots of coffee and a good workout.
There we go. Terry House.
Good morning.
Morning, Terry. Pamela Cruz.
Good morning.
Good morning. And Pete's going to be a little bit late, so we will identify him later on. Carrie Schaefer.
Good morning.
Morning, Carrie. And is Katie with us? Katie Hatfield from the AGO.
Good morning, everybody.
Morning, Katie. And I'm Lou McDermott. I'm the deputy here at HCA and the chair of the board. With both board members and presenters attending virtually, it'd be helpful if the board to hold their questions until each presentation is done, or when the presenter pauses and asks for questions. Board members will be watching in case you raise your Zoom hand to indicate that you have a question. The public's going to have an opportunity to provide general comments at the end of the meeting during the public comment period. Dave's going to provide an overview of the agenda.
Good morning, Chair McDermott, members of the board. Dave Eisinger here. Usually, this is our last board meeting of the season. We typically have one on the books just in case, depending on how rate development process goes. But I do want to be clear that today is going to be the last board meeting for the 2022 season. And usually it's a relatively short meeting. It still is a relatively short meeting, but we have a couple of important pieces of action for you. The first is Christine Davis bringing back a resolution that was originally introduced on the 23rd related to UMP accumulators rolling over if people are switching between the PEB and SEB program. The PEB program has already passed its mirror version of this resolution. Then Lauren Johnson is going to do one more update about the annual procurement process and how some things are anticipated to be applied during open enrollment with some of the plan changes that are on deck for your consideration when Tanya brings the premium resolution. And then as we round out the meeting, several of you I know have heard about some conversations and proposals that were occurring in the PEB portfolio specific to the Medicare population. And although retirees aren't part of the SEB program, as many of you know, a lot of SEB members who retire ultimately are eligible for benefits in the PEB program. And because it's such an important conversation, we wanted to kind of give you some foundational understandings of what that conversation is over in the PEB space. And then we'll round out with talking about next board season. 2023 is almost upon us, and with general public comment. So that's our agenda for today. And I also want to highlight in our what our backdrop is for HCA, just continuing to highlight different parts of our state. This is Mount Baker and also our majestic eagles that we often are fortunate to see here. That's where we're viewing for our viewing pleasure during this board meeting. And back to you, Lou.
All right, thanks, Dave. Our first agenda item is going to be the approval of meeting minutes. We're going to vote on 2 sets of minutes, and it's behind tab number 3. First vote is on the July 22nd, 2001 meeting minutes. Are there any comments from the board?
This is Terry House. I'd like to make a motion that we accept the minutes as presented for July 22nd, 2021.
Thank you, Terry. Is there a second?
Dan, I'll second.
Thank you, Dan. All in favor, say aye.
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 Any opposed? All right, the July 22nd, 2021 minutes are approved as written. Next vote is on the January 27th, 2022 meeting minutes. Any comments from the board? Do I have a motion to approve the minutes as written?
So moved. This is Carrie.
Thank you, Carrie. Is there a second?
Dan, I'll second.
Thank you, Dan. All in favor, say aye.
Aye.
Any opposed, say nay. All right, the January 27th, 2022 minutes are approved as written. Dave's going to go ahead and provide some follow-up from the July 7th meeting.
Right. I think the main question that I had as follow-up was, oh my gosh, I'm rather embarrassed at the moment. I can't think what the follow-up was, and I did not write my note down. I think the main question that came up from the last board meeting, just to reinforce, was there was a question about I believe, the dental discussion that's happened in the board over the last couple of months, and what the kind of next steps are for that. And I don't remember if I answered that clearly at the last board meeting, but where we are at this point is we've had conversations with both boards where the agency is working on a decision package, and that decision package will be submitted this fall to the governor's office for their consideration in the in the next biennial budget process. So when we come back in at the board retreat, that will be ledge session will be in full swing. The governor's proposed budget will already be out. We'll be able to talk about the current status of it. I believe that was the question that I had on deck, but if there's something somebody remembers was outstanding that I'm not recalling or finding quickly in my notes, please let me know if there's other things that you remember that we need to follow up on, but I think that was the follow-up.
Any additional questions or concerns from the board? All right, thank you. Thanks, Dave. Our first agenda item is the Uniform Medical Plan 2023 Benefit Resolution. Christine Davis, the UMP Account Manager, is back to ask the board to take action on the UMP Accumulators Resolution previously introduced. After she reads the resolution for action, I'm going to read the resolution. I'm going to ask for a motion and a second. I'll invite public comment. I'll ask for discussion from the board until we're ready for a vote. And her materials are behind tab number 4. Christine, welcome.
Thank you, Chair McDermott and members of the board. I'm Christine Davis, and as just mentioned, I'll be presenting on the Uniform Medical Plan Resolution for benefit year 2023 for your action. The resolution was previously shared with you during the June 23rd SEB board meeting by Jenny Switzer. Next slide, please. And so on screen, you'll see one recommendation for your action that we'll be reviewing, Resolution 2022-04. A similar resolution was passed by the PEB board last week. Next slide. Currently, when a subscriber moves from one board to another, all of their accumulators start over, which means that they would start with a 0 applied toward their deductible and out-of-pocket limit when they start with the new board. UMP is recommending that certain accumulators follow the subscriber when they switch boards mid-year due to special open enrollment, as long as they remain within a UMP plan beginning January 1st, 2023. All accumulators currently follow the member when they switch plans with the same board mid-year due to a special open enrollment. So this change would result in a more equitable experience for UMP members who leave the PEB board and join the UMP plan under the SEB board. This resolution will result in accumulators for deductibles and out-of-pocket limits following the member, resulting in a lower cost share for the member. A similar resolution was passed by the PEB board last week, and this change would need to pass both boards to be implemented. Next slide, please. Bringing this resolution back to you, this language is unchanged from the SEB board presentation that took place on June 23rd. A similar resolution was passed by the PEB board. This resolution was set out for stakeholder feedback. Since this was presented to the board on June 23rd, we received responses from stakeholders that were generally supportive. Board members will receive a copy of emails we received plus an Excel spreadsheet outlining those questions. Are there any comments or questions before I refer back to Chair McDermott on this resolution?
All right, thank you, Christine. We're going to go ahead and take a vote on Resolution SEB 2022-04 UMP accumulators. Resolved that beginning January 1st, 2023, when a subscriber enrolled in a PEB program uniform medical plan changes their enrollment to a SEB program uniform medical plan during the year, excluding open enrollment, accumulated deductibles and out-of-pocket maximum expenses, both medical and pharmacy, will transfer. Is there a motion to adopt?
This is
This is
Carrie. So
Allison.
moved.
This is Allison, seconded.
All right, we got first and second. And who was first again? I'm sorry.
It was Carrie.
Carrie. We got Carrie with the motion. The second is Allison. Any comments from the public? And if you have comments, please indicate by raising your hand. Seeing none. Any comments from the board? And I'm just checking to see if Pete Cutler has joined us.
Not yet, Lou. I'll make sure to announce whenever we see him.
Appreciate that. This is going to be a roll call vote starting with Dan.
Yes.
Donna,
Yes.
Amy,
Yes.
Allison,
Yes.
Terry,
Yes.
Pamela,
Yes.
Carrie,
Yes.
and Lou McDermott. Yes, resolution SEB 2022-04 passes. Thank you. Next agenda item is 2023 annual procurement update. Lauren Johnston, SEB program procurement manager or division, is going to provide an update on the 2023 annual procurement process. Her materials are behind tab number 5. Lauren, good to see you. Welcome.
Morning, Chair McDermott and members of the board. Thank you. For the record, my name is Lauren Johnston and I am the SEB procurement manager. Today I'm going to be going through a 2023 annual procurement update with you. We just have a couple of slides to go through. Next slide, please. So we wanted to discuss with you today HCA's enrollment transition plan. This is a draft plan for when SEB program subscribers do not enroll in a new plan during the annual open enrollment. So if that occurs, then one of the following will occur depending on where the subscriber lives or works. So as you can see there, we've got a table below. So we've got the current plan. So this is the plan that they are enrolled in 2022. And then we've got a column for a new plan if the subscriber lives or works in that plan's service area. And then we have the new plan if the subscriber does not live or work in the service area. So I'm just going to walk you through each plan one at a time there. So for the Kaiser Foundation Health Plan of Washington Options Incorporated, KPWA Options Access PPO 1, if the if the subscriber lives or works in the service area, then and they do not make a plan selection during the annual open enrollment, so they'll still be showing as Access PPO 1, then those members, HCA will automatically roll over into the new KPWA Options Summit PPO 1 plan. If the subscriber does not live in one of the counties, does not live or work in one of the counties where that new KPWA Options Summit PPO plan is offered, then they will be automatically enrolled in the UMP Achieve 1 if they do not make a plan selection during the annual open enrollment. So going down the line there to KPWA Options Access PPO 2, same thing. If the subscriber does not select a new plan during the annual open enrollment, and they live or work in the service area, HCA will automatically enroll them in the KPWA Options Summit PPO 2 plan. And if they do not live or work in the service area, HCA will automatically enroll them in UMP Achieve 1. For the KPWA Options Access PPO 3 subscribers, if they live or work in the service area, HCA will automatically enroll them in the KPWA Options Summit PPO 3 plan. And if they do not live or work in the service area, HCA will automatically enroll them in the UMP Achieve 1 plan. And then moving on to Premera Peak Care EPO, If the member lives or works in the service area, then HCA will automatically enroll them in the Primera HMO plan. And if they do not live or work in the service area, HCA will automatically enroll them in UMP Achieve 1. Are there any questions before I move on to the next slide?
Lauren, I just wanted to highlight for the board, this is something that is the administrative function of the agency, but we wanted to make sure that we were really upfront and clear with both you and members of the public as to what this automatic enrollment process would look like. The board set the original policy that when somebody doesn't act, they are put into coverage, not being uninsured in the program. And so the general rule and application of an automatic enrollment is UMP Achieve 1. This is kind of an exception to that process. This is called kind of a mapping exercise. We will map people as Lauren has described, and it's really about these plans are really very similar. The new plans are very similar to the plans that are being retired upon your vote of the premium resolutions in the next presentation. And this is really about minimizing the potential for thousands of appeals coming to both school districts and the healthcare authority. And I think many board members remember when we started the program, we had thousands of appeals. It was anything to minimize when there's the potential for thousands of appeals is really important for all of us and for the members that we're serving and the experience they have within the SEB program. So whereas we normally automatically enroll individuals into UMP Achieve 1, in this instance, with this overall wholesale migration of multiple plans being swapped from one to another that are very similar in structure, for the reasons that we've talked about, the service area needing to change, or in Primera's instance, moving into a formal HMO product line, we just wanted to do this type of transition plan to make it as least cumbersome a process as possible. Because from the member's perspective, if they live in the service area, it will be a very similar experience in Summit 1 compared to Access 1, or 2 compared to 2, or 3 compared to 3, and also very similar experience. And the benefit design is very similar for HMO compared to PPO and Primera's instance. So just wanted to put a little bit more spotlight on exactly what this is about, and just provide that additional context for everyone.
Thank you, Dave. All right, next slide, please. So you guys are very familiar with this slide. This is the proposed 2023 service area. This is what we call our tile map. So just kind of wanted to do a brief overview comparing the previous slide with this slide. So the overlap area that is described on slide 2 in column 2 includes King, Kitsap, Pierce, Snohomish, Spokane, and Thurston counties for the KPWA options plans, and Pierce, Spokane, and Thurston counties for the Primera HMO plan. And then the overlap area that is described on slide 2 in column 3 includes Island, Lewis, Mason, Skagit, and Whatcom counties for KPWA options. Any questions? All right, next slide. I think that is my question slide. So that's all for me if there's no questions.
No questions.
Again, thank you, Lauren. We just wanted to make sure that this was very clear to the board before you acted on the premium resolutions, because it was how we would implement the effect of those premium resolutions. That's why it was brought to you right when it was today.
Correct.
Seeing no questions from the board. Thank you, Lauren. Appreciate it.
Thank you.
Next up, 2023 premium resolutions. Tanya Duell, our finance manager, is back to ask the board to take action on the 2023 premium rates. This is the main show, folks. After Tanya reviews the resolution for action, I'm going to read the resolution. I'm going to ask for a motion to adopt. A second, I'll invite public comment. I'll ask for the board for any comments or discussion until we're ready for a vote. Her materials behind tab number 6. Tanya, welcome. I know it's been a long board season. They always are. So do your thing.
All right. Thanks, Chair McDermott. Correct. It has been a long board season with rate development, but we are here to ask the board to take action on the final 2023 premiums. These are the proposed premiums that we presented on July 7th, and they are included in the appendix for the board's reference. Like Dave just mentioned, each of the resolutions are sorted by carrier. So there's one resolution proposed for each carrier. And by the board passing that carrier's resolution, the board is adopting each of the plans and the underlying plan design, as well as the premiums for each of those carriers. So the first one on the next slide is the proposed resolution for KP Northwest. Each of the resolutions will look very similar. They are the same minus the carrier name. So I think if there are no questions, it probably makes the most sense to pass this back to Chair McDermott to walk through each of the resolutions.
Tanya, there's a question that someone asked me in the last 2 weeks that I think would be good for it to be on the record and just to make sure it's clear. So for board members, just Tanya has put in the appendix of her presentation the key slides that have the rate information and the premiums that are underlying these resolutions. And the question that was really raised was wanting to make sure to understand why certain rates have such dramatic decrease and others have, slight increases, and if there was any more clear explanation about that. And I'll just have the slide moved to slide number 11 just for a moment to maybe explain this. And so, for example, you just see some very dramatic differences on slide 11 and slide 12. And what the concept that I want to make sure everyone walks away with is the bid rate, the underlying amount that the carriers, that all the carriers at UMP came forward with, that was calculated by HCA, all of those actually increased. Yet you see decreases in certain premiums here. That's very counterintuitive. What happens is, under the collective bargaining agreement, the employer contribution is set specifically based on UMP Achieve 2. So if we go to slide 12, we see UMP Achieve 2, that near the bottom there, had an increase. And so that is driving how much the employer contribution is on medical. And so all the other bid rates will, depending on their relativity of increase to UMP Achieve 2's relative increase, will manifest as different premium increases for employees. So for example, on slide 11, you see a lot of decreases in KP Northwest plans. What that means is, although there is a bid rate increase for Kaiser Northwest, relative to UMP Achieve 2's increase, it was smaller. And that means since the employer medical contribution is going up, there's more of that bid rate that's being covered by the employer contribution. So it's really this dynamic that what happens in UMP Achieve 2 financially drives that EMC, and that employer medical contribution will manifest as decreases or increases based on the relativity of each bid rate compared to UMP Achieve 2. Tanya, I might have said that very confusingly, but if there's, it's just an important concept that people wanted to, I've had that discussion with multiple people in the last 2 weeks, and I thought it would be good to try to say that on the record.
Yeah, I think you nailed it.
So I just wanted to put that on the record as we were going through pieces, because I think it's an important concept for folks to understand.
Any questions for Tanya? All right, we're going to go ahead. Thank you, Tanya. Appreciate your time. We're going to vote on the premium resolution SEB 2022-05 KP Northwest medical premiums. Resolved that SEB board endorses the Kaiser Foundation Health Plan of the Northwest employee premiums. Is there a motion to adopt?
This is Carrie, so moved.
Is there a second?
Dan, I'll second.
Are there any comments from the public? Please indicate that you would like to speak by raising your Zoom hand. Seeing none, are there any additional comments from the board? Seeing none, this will be a roll call vote starting with Dan.
Yes.
Donna.
Yes.
Amy,
Yes.
Allison,
Yes.
Terry,
Yes.
Pamela,
Yes.
Carrie,
Yes.
and Lou, yes. Premium resolution SEB 2022-05 passes. Next, we're going to vote on premium resolution SEB 2022-06. KPWA medical premiums. Resolved that the SEB board endorses the Kaiser Foundation Health Plan of Washington employee premiums. Is there a motion to adopt?
This is Terry. I'd like to make a motion to adopt.
Is there a second?
This is Amy. I second.
Any comments from the public?
Chair McDermott, I'm not really the public, but I do just want to be really clear for the record that adopting this premium is officially moving forward the summit plan and therefore, and closing the access plan. So I just want that really clear on the record.
Understood. Seeing no requests from the public to speak, any comments from the board? Seeing none, this will be a roll call vote starting with Dan.
Yes.
Donna,
Yes.
Amy,
Yes.
Allison,
Yes.
Terry,
Yes.
Pamela,
Yes.
Carrie,
Yes.
and Lou, yes. Premium resolution SEB 2022-06 passes. I gotta say, folks, we're kind of getting good at this virtual thing. That's very smooth. I appreciate that. Now we're going to have a vote on premium resolution SEB 2022-07. KP.
Option.
Yeah, KPWA option. Okay, I was like KP wow. So yeah, KPWA option medical premiums. Thank you, Tanya. Resolved that the SEB board endorses the Kaiser Foundation Health Plan of Washington Options Incorporated employee premiums. Is there a motion to adopt?
So moved. This is Carrie.
Thank you, Carrie. Is there a second?
This is Allison. I'll second it.
Any comments from the public or Dave? Either.
Yes, actually, what I said on the last resolution actually applies to this resolution. So I'm sorry for the confusion. This is actually the resolution that changes from access to summit. So we'll strike that from the minutes whenever we do the minutes for the prior resolutions. This is the one that changes. And so my apologies for that mix up. And I'm also embarrassed nobody corrected me.
You're making Connie's life rough here. You got all that, Connie?
Got it.
Okay. I seeing no other requests from the public. Any comments from the board? Seeing none, we're going to do a roll call vote starting with Dan.
Yes.
Donna,
Yes.
Amy,
Yes.
Allison,
Yes.
Terry,
Yes.
Pamela,
Yes.
Carrie,
Yes.
and Lou, yes. Premium resolution SEB 2022-07 passes. Can we put 08 on the screen, please? Bingo. Vote on premium resolution SEB 2022-08 Primera medical premiums. Resolved that SEB board endorses the Primera employee premiums. Is there a motion to adopt?
Pam Cruz, so moved.
Thank you, Pam. Is there a second?
Second, Carrie.
Thank you. Are there any comments from the public or from Dave? Seeing none, are there any comments from the board? Seeing none, again, this will be a roll call vote starting with Dan.
Yes.
Donna,
Yes.
Amy,
Yes.
Allison,
Yes.
Terry,
Yes.
Pamela,
Yes.
Carrie,
Yes.
and Lou, yes. Premium resolution SEB 2022-08 passes. I was going to mix up the order a little bit there, but I didn't want to blow everyone's mind, so I curbed my childish ways and did not do that. 09, vote on premium resolution SEB 2022-09 UMP medical premiums. Resolved that the SEB board endorses the Uniform Medical Plan employee premiums. Is there a motion to adopt?
This is Allison. So moved.
Is there a second?
Pam Cruz, second.
Thank you, Pam. Any comments from Dave or the public?
I do have one on this one, Chair McDermott. I believe at one point we had some update this board season, and if not, this is still a germane comment. The Uniform Medical Plan premiums include UMP Plus, and many people know that we were under contract negotiations with both of the networks, UW Accountable Care Network and Puget Sound High Value Network, and we have reached commitments with both of them to extend their contracts for several years. And so if that was lingering in anyone's mind from different conversations at some point in this board season, or just wanted to be clear that we have agreements and commitments with them to proceed with their plans for several more years. And so just wanted to clarify that for everyone.
Awesome. Yes, Dave, congratulations to you and your team for making that happen. I know these negotiations can get a little dicey, so nice job, folks. Seeing no additional requests from the public, is there any comments from the board? Seeing none, this will be a roll call vote, starting with Dan.
Yes.
Donna.
Yes.
Amy.
Yes.
Allison.
Yes.
Terry.
Yes.
Pamela.
Yes.
Carrie.
Yes.
And Lou, yes. Premium Resolution SEB 2022-09 passes. All right, the next agenda item is going to be PEB Medicare Portfolio Overview. Ellen Wolfhagen, she is the Senior Account Manager for the PEB Retiree Offering, is going to share more information about the Medicare portfolio. Her materials are behind tab number 7. Ellen, welcome.
Ellen, you're on mute. While Ellen's coming off mute, Pete Cutler has joined. So just want to note that for the record. And Pete, we just finished up premium resolution voting, and we are under tab 7 on the PEB Medicare portfolio overview. And Ellen looks like she's off mute.
Good morning, Chair McDermott and members of the board. My name is Ellen Wolfhagen. I'm sorry for that technical difficulty. This morning, I'd like to talk with you about the PEB Medicare portfolio. You may be wondering why I'm making this presentation for the SEB board. It's because, as you know, although there's no retirees in SEB, generally K-12 employees have state retiree benefits, enjoying PEB for health and dental coverage. Retirees are in 2 different risk pools and portfolios. The Medicare plans make up the Medicare portfolio, and non-Medicare retirees access the same plans as active employees, but they're self-pay. Next slide, please. We wanted to share some of what's been going on with the PEB board with SEB and your employees, because they're going to become PEB retirees. The premium for the 2023 UMP Classic Medicare is going up by $73.47 per month. So HCA offered a resolution to close the UMP Medicare plan in 2024, keeping in mind the obligation to offer cost-effective healthcare plans. The premium for the UMP Medicare plan is significantly higher than any of the other Medicare offerings in the portfolio. This resolution was just for Medicare and does not affect non-Medicare retirees or active employees enrolled in uniform medical plans. Based on feedback from retiree groups, especially the Retired Public Employees Council, also known as RPEC, HCA recognized the need to provide more opportunity for feedback and input. Therefore, the board voted to postpone action related to plan closure until at least January 2024. Next slide, please.
Ellen, as we transition, I do want to say RPEC had a significant voice in raising concerns, but also the retiree segment of the WEA also had significant concerns that were raised along in conjunction with RPEC. There were a variety of different organizations, but the primary organizations that were raising a lot of concerns were RPEC and WEA retiree, and I wanted to point that out, considering the connection to school employees.
Thank you, Dave. So this is an overview of the PEB Medicare portfolio. We have a number of different types of plans, so I thought it would be useful to go through what those different plans are and how they function. UMP Medicare, which is known as UMP Classic Medicare, is a coordination of benefits plan. Original Medicare fee-for-service, that's what FFS is, pays primary on medical claims, and UMP pays secondary. There's creditable drug coverage, and what that means is drug coverage as at least as good as Part D coverage. It could be lower cost, it could have a different formulary, but it is at least as good as Part D. For UMP, UMP pays primary and in fact is the only payer on pharmacy claims. Under the Kaiser plans, we have Kaiser Washington has an original Medicare coordination of benefit plan, which works in a similar fashion to UMP. And there are two Medicare Advantage plans under Kaiser, one with Kaiser Northwest and one with Kaiser Washington. Medicare Advantage plans offer original Medicare coverage as well as some supplemental benefits. The Kaiser plans also offer creditable drug coverage. It should be noted that the Medicare Advantage plans offer lower premiums and in fact no restrictions on enrolling retirees with pre-existing conditions. The next box, the orange box, are the United Healthcare PEB Balance and PEB Complete plans. These are Medicare Advantage plus prescription drug or Part D coverage. These are known as MAPD plans. In 2021, HCA began offering the UHC MAPD plans. This was in part an outgrowth of the 2020 retiree survey, which identified concerns about costs, premiums, copays, and out-of-pocket as the most significant issue for the 7,000 retirees who responded to the survey. MAPD plans are also PPO plans, as you know, preferred provider organization plans. They have more than a 95% overlap in coverage with UMP's provider network, and the UMP plans are nationwide.
Ellen, just real quick, I want to say something because we just had the last PEB board meeting of the season yesterday. 95% was the preliminary number, but as we had further analysis, the provider overlap was closer to 97%. So for those people who were listening to yesterday's board meeting, I didn't want them to hear one number yesterday and one number today. 95 was preliminary, 97 was where things landed, and so 97 is the correct number. Thanks, Ellen. Back to you.
And I will just note that most of the providers that are not in network, that are not part of the overlap, are in the hearing aid market, where United Healthcare has its own limited network. Under the MAPD plans, there is no difference in cost pay between in-network and out-of-network. So it's not a network question. It's really a question of, does the provider accept the plan? And that's where that 97% overlap is very important. Both MA and MAPD plans, as I said, offer supplemental benefits. Those are things like chiropractic, acupuncture, massage therapy, vision and hearing services, as well as gym memberships. The last column is the supplemental plans. These are also known as Medigap. These plans were designed specifically to cover the 20% of medical costs that are not covered by Medicare. Coverage is limited only to those services that Medicare covers. And all of these plans, including the Medigap plans and MAPD, all of them except UMP, and you'll understand in a second why, are employer group plans and differ from those offerings on the individual market. The reason that doesn't apply to UMP is that's not the kind of plan that would be offered on the individual market. Next slide, please. This is an overview of how Medicare works with the retiree plans within PEB and the general structure. So as I said, UMP Classic for medical coordinates with Original Medicare. The MA plans, Medicare Advantage, including MAPD, include Medicare's Part A plus Part B plus supplemental benefits. And as you can see from the orange, it also includes Part D coverage. And then Plan F is just to cover the out-of-pocket costs for Original Medicare. It is important to note that Plan F and Plan G offer no drug coverage, and enrollees in those plans must obtain a different individual market plan for drug coverage. Are there any questions before we move on? Next slide, please. Next, we want to give you a flavor of the types of activities we will be engaging in with retirees in the coming months. Next slide, please. So of paramount importance is hearing from retirees, including WEA retiree groups, RPAC, and WSSRA, all very active employer groups with us. And our goal is to seek input from retirees about their experiences, concerns, ideas with the plans in the Medicare portfolio. We also want to offer information about the funding and structure of the different plans. It's important to stress that PEB plans are different than the plans available on the individual market. And meaning that we have negotiated better premiums, copays, out-of-pocket maximums, coverage options, etc. And what we have found so far is there's a great deal of confusion about this, and we're hoping to clear that up. Next slide, please.
Ellen, before we go to the next slide, I do want to highlight one piece because we've had so much conversation at the PEB board, and if people aren't as familiar with the Medicare space, which understandably we haven't had a lot of conversation here at the SEB board for the reasons that we don't have retirees in this program, I do want to highlight that one of the big dynamics that happens in the PEB portfolio is about plans that get substantial federal subsidies and plans that don't get those same federal subsidies. And if you were to peek and look at the premiums of the UMP retiree portfolio, as Ellen said, UMP Classic has a significantly higher cost. The annualized premium is over $5,000, whereas the other plans in the portfolio range from about $1,500 to $2,200 per year. So there's almost a threefold difference in the annual premiums. And one of the things that is underlying all of that is UMP, as a coordination of benefits plan, is not eligible for additional and substantial subsidies that all the other plans can access. And so that's why we see this divergence in premium. And essentially the way that the current structure of subsidies work, and there are multiple subsidies at play, any cost increase in UMP Classic Medicare is fully borne by the subscriber at this point. The state subsidy is maxed out. There are only certain federal subsidies are in play, but the vast majority of them that apply to the other plans don't exist. And so it manifests as every dollar that is increased in UMP Classic Medicare is borne fully by the subscriber. And that is not the case for the other plans. And the other plans in the portfolio also have access to other federal subsidies. And the main question we've been getting asked is, why is that the case? and it's written into federal statute about 20 years ago when I think it was around 2002, 2003, federal law was created these subsidies for Medicare Part C plans, which are primarily what the other plans are. And so CMS can only give subsidies of that nature to certain plans, and UMP just simply doesn't qualify for it. So it would essentially take an act of Congress to change the subsidy structure of those substantial subsidies. And so there's a really big structural disadvantage. And when we look at the cost of care and hearing concerns, that's what raised those fiduciary concerns and prompted the original proposal that has since effectively been tabled for these engagements to occur and to have conversation about the future of the portfolio and offerings. So just wanted to give a little bit more background because without that structural subsidy insight, you might look at the PEB retiree portfolio and go, why is that one premium so much more than the others? And this is part of the conversation, and hopefully, we'll be listening and dialoguing and educating and providing information all at the same time, and that is one of the key things to help people understand. Do you have a question or comment?
Yeah, I have a question, Dave. How much in additional premiums are our retirees paying to be in this unsubsidized plan?
There's a couple of different ways to answer that. Can you say your question again, Lou? Because I thought of like 3 different ways to answer it, and I'm not sure which to pick.
I mean, ballpark, if they were to be in a plan which is eligible for those additional subsidies from the federal government, how much more in premiums are they paying now than they would if they were in one of those plans? I'm just looking for a ballpark, the entire population, just a number.
Yep. Today in 2022, the difference between UMP Classic and probably the most comparable plan in the retirement portfolio is about $2,500 annually per enrollee. So if a retiree subscriber is enrolling themselves and a spouse, that's $5,000 annually. In 2023, that jumps to $3,500 an enrollee, so $7,000 in that subscriber and spouse situation. And if you multiply that out, we have about 53,000 to 54,000 individuals, member lives that are in UMP Classic. That's the tune of like $180 million annually.
Understood. So our retirees who are mostly on a fixed income and fighting 8-9% inflation are paying an additional $180 million in premiums.
And yes, and I think it's fair to say the conversation began at the PEB board about kind of the economic value of the plan. But there are certainly many important voices that have come forward talking about aspects of the Uniform Medical Plan in the retiree setting that are important factors for them that should be weighted alongside of the economic part of the equation. And so, I say this a lot in both programs. We have a variety of plans because we have hundreds of thousands of members, and everyone's circumstances, all of the plans make sense for somebody. At the same time, the agency really was looking at that disparity or that wide economic difference and really wanting to promote and move forward this conversation, because we know that the structural subsidy disadvantage that I described a few moments ago really, there's no indication that that's going to change anytime in the near future. And so we're going to continue to see this divergence in premium, this escalation of costs within UMP Classic relative to the other plans. And we really want to engage everyone on this conversation at this point, because it's very challenging to see how sustainable UMP Classic is going to be in the long term. And it's something that we've been highlighting in different ways since the last large rate increase, which was 5 years ago and was also about 20%. We've been on a journey, a strategic journey as a state and as an agency to try to find ways to make ensure that there are affordable comprehensive benefits. That's what led to the United Healthcare MAPD plan through a procurement. But, you know, it is definitely clear from the voices that we've heard that in addition to the economic part of the equation, there are other parts of the UMP Classic that people think are and feel and experience as really important to we as an agency need to work on helping provide more information so that those who really wouldn't see a difference if they switched to a cheaper plan could pocket that out of that annual premium and use it for anything else in their lives other than medical premium. Because undoubtedly there are many people currently UP Classic who would see little to no difference if they switch to a different plan. And we want to make sure that we get as much information to them to help them make as informed a choice as possible.
Dave, I recall when we did the UMP Plus program, we sent letters to folks saying, hey, if you were in UMP Plus, based on who you are and your circumstances, you would save X number of dollars per year. Is there any consideration the program is going to send something out to retirees, letting them know, you know, based on your particular circumstances and your patterns of utilization, your world would change or not change if you were to switch plans, and this is the money you would save?
We are definitely planning as part of just general, that was in the plans before this most recent rate setting, because your first question was about the difference in premium. I said today it's $2,500 per enrollee. We were wanting to make sure that people really tried to engage and understand. One of the challenges is that the MAPD products were brought up in 2021, which, as most people remember, was during a pandemic. We weren't having benefits fairs in fall of 2020 to share with people and have that in-person dialogue about new plans. And so there's a lot of individuals, even in the last 60 days, that said, well, what's the other alternative? And our answer is, oh, we need to get you information about the plan that's been around for just 18 months, but there are a lot of people who didn't even realize there's another plan offering. So we are planning some sort of general educational campaign about, you know, if you're worried about the economic value of your plan, make sure to know that there are other nationwide choices for you to look at. And if it does meet your needs, it also will save you a lot in premium. But helping provide that, yeah, that's certainly on the fall open enrollment kind of communication to-do list, is to really put more front and center, more information about these differences, and hoping that gives people information that they don't have today, and that they can make the best decision possible for themselves for 2023.
Well, I appreciate it. I will let it go, but it does break my heart a little knowing that an enormous amount of money is being spent by our retirees for, in most cases, for little to no difference. So I will let it go, but I appreciate the information. Ellen, sort of back to you.
Thank you. Next slide, please. So building on what Dave said, we are going to use retiree insights to improve future retiree communications, including during open enrollment. And, you know, some of the things that we've heard are clearly economic, but we've also heard lots of other things. We want to share the challenges inherent in managing the retiree portfolio. And some of these are because of the ways that the different plans engage with Medicare. So there's different levels of benefits, different coverages. Even for similar types of Medicare plans, there are differences with the individual market. And our plans are employer group sponsored plans, which is a very different kind of plan. And there's also limitations between the coordination with federal rules under CMS and PEB rules. So there's lots of information that we can share about all of that. And also rebuilding and strengthening the relationship between our retirees is very important. We're working with WEA, WSSRA,
Chairman McDermott, can you hear me?
Yeah, I froze up a little bit there. Hang on, I'm coming out of it. One more
We
time.
all froze. We all froze. I'm not sure if anyone can hear Ellen at the moment.
I cannot, Dave, but I can hear you and Chair McDermott.
Yeah, this is Katie Hatfield's name. I can hear the HCA room as well as Lou easily, but I can't hear Ellen.
Okay.
Okay. And any board member checking in?
This is Terry. I'm here.
This is Allison. I'm here.
Pam Cruz is here.
Yep. We're all here.
Okay. Dean, are you on? Could you pick up for Ellen? Okay, I will take on for Ellen. I'm the backup to the backup. So the last goal of one of the big goals of these retire engagements is really strengthening that relationship and rebuilding trust and collaborative work with retirees. There are a variety of organizations, Ellen was saying, WEA, WSSRA, as well as RPEC, that we're going to be engaging with and collaborating with to have lots of different engagements. Some of them will be presentations to provide educational information. Others will be dialogues. There will be formal listening sessions. It really is going to be driven by what each organization wants to have as part of these engagement sessions that we'll be planning over the next 6 to 12 months at a minimum. And I see Ellen's back, so I'm going to turn it over to her. I think we're ready for slide 8.
I apologize for that brief interlude. I'm not sure what caused that. So we already have many stakeholder opportunities, like Dave just discussed, booked for this summer and into the fall, but we welcome additional engagement opportunities with our members. So please feel free to reach out to me and let me know of situations where there might be groups of people who are about to retire or already retired, and they want to talk about this. We will be back during the 2023 board season to bring you information about what we have learned. Next slide, please. For the PEB board, we will be inviting members to attend some of those engagement sessions, and we'll be providing what we have learned so far in the summer and fall at the January 2023 retreat. We plan to make more presentations during the rest of the 2023 board season on the Medicare portfolio and our communications efforts with our retirees. Next slide, please. And again, for the SEB board, I hope to come back to you with a summary of what we have learned and any questions that we can answer. And I think that is it.
As we open up for board questions, there's one more piece of information I want to make sure is really clear. The number one question I think you might have or SEB members might have is, does this have any potential impact on the UMP offerings in the SEB portfolio? And the answer to that is no. And it goes back to that federal subsidy piece. There are 3 risk pools that exist between the PEB and SEB programs. SEB has 1 risk pool for active school. Ellen opened up that there are 2 risk pools in PEB. One's non-Medicare and one's Medicare. The structural financial disadvantage that, quote, UMP has is specific to the Medicare risk pool. And so there was a brief point in the last 6 to 8 weeks where we started hearing from state employees. Does this proposal would this close UMP for state employees? And the answer was no, because it doesn't impact the non-Medicare risk pool. I just wanted to be really clear for this board and anyone listening here is that proposal, it was really related to that structural disadvantage on federal subsidies that's unique to the Medicare risk pool. That's why it was a proposal specific to the Medicare risk pool. And so there are structural financial concerns related to the general UMP offering that exists in the PEB non-Medicare risk pool, nor the SEB risk pool. And just wanted that to be really clear, because I didn't want anybody to walk away from this presentation worried about UMP and SEB, because the financial structure is completely different.
Thank you, Ellen. Any additional questions from the board? All right. Good luck on this important topic. Appreciate it.
Thank you.
Next up, Dave is going to talk about the 2023 SEB board meeting schedule. Well, that was, I don't know why that was a tongue twister. It shouldn't have been. But what do we got going, Dave? Tab number 8.
Yeah. Behind tab 8, this is ready for your calendaring pleasure, if you will. We always, as we end out the board season, officially publish the entire board season for the next year. You'll notice the continued theme of a retreat that is an all-day event at the end of January, and then continuing, I believe, generally Thursday mornings, always starting at 9. We keep kind of recalibrating. It's important to know that this is all published as part of Open Public Meetings Act requirements, and we always, it's easier to have shorter meetings than it is to extend meetings during those times, and so we kind of cast a wider net. For example, today, we're clearly not going until noon or 1 or even 2 o'clock, so we ask you to kind of mark your calendars for the full time that's on the schedule, but as we get closer to the actual date, as you know, we publish the agenda and you start to see what a more likely end time is. I do want to note in July, just like this year, we publish 3 meetings. Our goal is always to use 2 of them, but because we don't know exactly how rate season is going to land, we over schedule and then cancel, just like we're canceling the previously published meeting for next week. And then the other factor here is the proximity to the 4th of July and the way the calendar falls. Sometimes it's just too difficult to have a meeting that early in July. But I did want to draw attention that the goal is always to have 2 of those 3 meetings. We never really know which ones until we get there. It's pretty safe to say we'll have one on the 13th. Or I won't even say that. I shouldn't use that. Well, the goal is always to have 2 of the 3. But wanted you to have this schedule in advance and that context. And any questions about next year's board schedule?
All right, thank you. And we're at the stage of the meeting where we call for public comment. If anyone out there would like to speak, please raise your hand on Zoom, and we will get you lined up here. I see Fred, and I don't see anyone else. So Fred, why don't you go ahead and start us off? Mr. Yancey.
Thank you, Mr. Chair. Fred Yancey on behalf of WSSRA and WASA, which is the school administrators. First of all, Chair McDermott, thank you very much for your sensitivity and awareness to the effect of these rates on a retiree. These rates will eat. You know, if you look at one chart that Mrs. Wolfhagen did not share, is the average pension that retirees receive, and these rates, you know, could take up as much as 20 to 30% of their retirement income, monthly income, just for the insurance benefit, and that's of course depending upon which plan they pick. But again, thank you very much for your sensitivity to that issue. It's certainly a concern, and they're very concerned. Secondly, I don't think, with all due respect, David responded to your question of, and maybe I misunderstood your question. The healthcare authority, I don't think, is going to send individualized letters to people saying, look, you're currently spending X for, you know, insurance. These are other choices that you could have if you were interested in looking at alternatives. What the healthcare authority has done and is in the process of doing is showing charts where, if somebody looking at that chart can clearly see a rate difference, but it's not individualized, if you understand what I'm saying. So, but that's fine. It would be real nice if it was individualized and an individual was given notification saying, you know, you're currently paying this, because individuals may not know that. We're afraid that some people won't have the mental acuity to, you know, to figure it out and just stay with what they've had. But anyway, that issue aside, and my last point is I just want to specifically thank you and the members of the committee for all the work you've done this season. It's I always find it very educational, and I learn an awful lot because I start from a position of ignorance. So I appreciate that. In particular, and I forgot to say this yesterday, Dave, your leadership is appreciated and certainly noted, and the quality of your team and their efforts is also very valued. So thank you all to everybody. That's all I have to say. Thank you.
I appreciate those kind words, Fred. And I want to address the letter. Actually, we have sent out letters specific to a person's individual circumstances and explained to them what they would have saved if they were in the program. So we have done that in the past, and my hopes are that we're going to do that in the future with this issue, because I do think you're right. Just sending out a chart and saying, here's a big chart, here's some different prices, I don't think that quite does it more than a letter that specifically addresses your circumstances. So I'm sure there's going to be some work on an algorithm to figure out, who these letters need to go to and what they need to say, but super important issue, and I appreciate your comments.
I appreciate it. Thank you.
Yeah.
And Fred, just for clarity, there's, this is getting into the administrative weeds. We're looking at a couple of different options. We do send a customized packet to retirees each fall as we head into open enrollment. One thing we're looking at is there a general or specific type of insert that can be included in that custom packet, or is there a separate letter that, but we already do some level of customization on open enrollment materials for retirees. So we're looking at how to leverage that in a couple of different ways. So we're anticipating that everybody will get something, the exact mechanism, and as customized as possible, since that's something we tend to do in our retiree communication for open enrollment already. So there's efforts underway to figure out the best way to leverage something that is currently used.
We do receive a letter that says prior to the open enrollment, or maybe it's at the start of open enrollment, saying, the open enrollment period, you currently have this insurance and this is the cost. But I don't believe it goes any further than just that, other than it says you have options here, but it doesn't detail those options. Just says it does indeed, as you say you're spending this for your coverage currently.
And Fred, that's exactly one of the areas that we're looking at is, can that specific letter be further customized to highlight about the cost of those other options as an example?
Appreciate it.
We're looking at that exact type of thing to leverage and see how that could work out. No
Thank
promises.
you.
We're looking at different ways, but there will be something that is sent to everybody.
Thank you.
As customized as possible.
And I'm looking at the roster here of folks. I'm not seeing anyone else's hand up. So if you are a member of the public and you would like to speak, sort of going once, going twice, and I think that is it. Well, everyone, this is our last board meeting for the season. We're going to start again in January with the board retreat. I really want to thank Dave, his team, all the board members who make sacrifices to be here, and members of the public who come to our meetings, especially today, and for those who come to each meeting. Really want to thank you. It is a process to get to done. Every twist and turn in these board meetings and comments made from the public definitely impact the way this program is run to a level that probably would surprise most, but it does impact the program. And I think we've landed in a good place this year, and I appreciate all the work. And I will turn it over to Dave for any final comments before we adjourn.
I have two. The first is I'll be reaching out to various board members. We have an annual reappointment process, and half of you have your natural time expires, and we have to talk about interest and engagement and reappointment. So I'll be reaching out in August about that. And it's also hard to know exactly for whom this will be the last board meeting, but there's two people I think that probably it's their last board meeting. And so I just want to make sure to publicly thank a few people for their service. And if somebody ultimately isn't returning after, and I don't want people to announce that if they're planning to leave, I'd rather have that conversation. But there are a few people who I know this is planned to be their last board meeting. So I want to make sure that Dan Gossett gets recognition as one of the original board members. He's following in his classmates. Many of you might not know, he and Wayne Leonard were classmates when they were going through K-12 rather than when they were serving K-12. Wayne retired last year. Dan's on his retirement journey. I'm glad, Dan, that we were able to give you a personal retiree webinar at a public meeting as you begin planning for your future retirement and potential participation as a retiree. But want to thank you for your service since 2017 on the board, and all of your work in bringing up the SEB program. And then Pete Cutler, you've been very gracious with me as I've worked on a recruitment. You asked me to make sure I had a recruitment in place so that last season was your last board season. Yet here we are again a year later, and I do have a commitment to make sure that you can return fully to your retirement. But thank you for your grace and participation, and a further extension of your service to the SEB board. There's only so many times I can say thank you for your service at a potential last meeting, but we will work very hard to make sure that we can respect your request to complete your board service. So I just want to make sure that say those about both Dan and Pete. I'll be reaching out to others who are up for natural reappointment processes in the next month. And just wanted to say, this was a relatively, in the grand scheme of the 5 years of SEB, a relatively easy board season. It's nice to have some easier years, because some years are much harder than others. As you can see, we have a lot of engagement on the PEB board season this year, so it was nice to have some steadiness here in the SEB program. I appreciate everyone's work this season, the staff, the board, members of the public for engaging, and that just rounds out. Happy to be closing board season. Effective tomorrow, we officially turn into open enrollment operations mode 24/7, and we are off to the races. And so it's just really important. The work that you've done today has set the stage. As soon as the premium votes happen, there's many things that immediately cascade out of these votes, and no rest for the healthcare authority. So we will move into open enrollment, and thank you again for this year. I do see Pete has some comments. So Pete?
Yeah, I wouldn't be myself if I didn't have a comment. I just want to thank you, David, and Lou, and everybody at the Healthcare Authority, just for all the work you've put in over the years, and this year specifically. It's just really an honor and privilege to work with you and with the other board members. I want to thank all the fellow board members for collegiality and their public service ethic, and just say it's been a pleasure. But I do think this is probably my last meeting. I think retirement travels will probably really necessitate me finally moving off into the sunset. So thanks very much.
This is Dan, and I just want to echo what Pete just said. The professionalism of everybody at the Healthcare Authority has just been awesome and amazing to watch. The people on the board, I've enjoyed your company. Too bad it's not in person anymore, but that was always good to talk to you at the meetings. Thank you. It's been an honor and a privilege.
All right, Dan, thank you for your service. Wish you the best of luck in retirement, and know you always have a friend here at the Healthcare Authority. If you run into any issues related to your healthcare, you give us a ring. And as far as Pete goes, yeah, we'll see you next season, Pete. I know, Dave, you'll be back. And if not, you take care of yourself.
And Lou, I do realize I have one more comment about next board season and the structure of meetings. None of us know what the world will look like in 6 months, and the board has the authority to continue to have all virtual meetings. I think one of the challenges is it's supposed to be more rooted in the current circumstances, and it's hard to make a decision about January and July. But what I do want to reassure everyone about is if and or when we have what we call hybrid meetings, where there's a physical space in Olympia, just like the original board days pre-pandemic, where many of us are in the Zoo Crystal room, which some of you have probably never even seen, we will support hybrid attendance. It will not go back to a, fully in-person meeting. We've had a lot more engagement and access to public meetings for members throughout the state by being virtual. And when we are in a hybrid setting, board members and the public will then have the choice as to whether they want to attend virtually or in person. And we'll be supporting both of those. So we'll see what the circumstances are as we get closer to January as to what the world looks like and if there is that in-person option for the retreat or engaging with the board about the potential or need to continue in an all virtual setting. It's unfortunately premature to have that conversation on July 21st, but did want to make sure that people know that when there is a physical space requirement under the Open Public Meetings Act, there will be choice as to how people participate in the board meetings, both for board members as well as the public.
All right. If there is nothing else for today, this meeting's adjourned. Have a good one, folks. Take care of yourselves.